In our previous video, we did diseases and we talked about measles, but let's talk about it and continue from there. Measles is a highly contagious infectious disease caused by measles virus. Symptoms usually develop 10 to 14 days after exposure to an infected person. So now let's look at causes of measles. How does it spread? Measles spread by airborne respiratory droplets when you cough or sneeze. If you sneeze or you cough, you will spread the disease. 2. By saliva, that is kissing or shared drinks. And we talked about touching a contaminated surface, that is blanket or doorknobs, and we talked about by skin to skin contact, that's handshakes or hugs, and we said that it could be spread from mother to a baby by when the mom is pregnant or in labor or nursing the baby. So let's talk about symptoms of what? Measles. So measles symptoms don't appear until 10 to 14 days after exposure. So the symptoms are 1. Coughing. 2. Runny nose. 3. Fever and red and blotching skin. That's 4. Sore throat and what? Inflamed eye. So these are the symptoms of measles. So if you have measles, this is the signs and symptoms that you'll be showing. So let's go to treatment. Do we have treatment for measles or no? Let's look at it. So treatment. There is no treatment to get rid of an established measles infection, but over-the-counter fever reduces or vitamin A may help with what? Symptoms. So as we know, we don't have what? Treatment for measles, but scientists have worked with and bring out what? Vitamin A has what? As it may help with symptoms. Okay, so let's go to prevention. So the only way to prevent measles is to get the measles, mumps, and rubella. That's the MMR vaccine. So 1 MMR vaccine provides around 93% protection against measles, and a second booster dose, which started to be recommended in 1990, helps to improve the effectiveness of the measles to more than 97%. So what should we do, or what should be done if one is exposed to measles? If you have measles, you should stay home for 4 days after you have developed the rash. So staying home is an important way to not spread measles to other people. So ask your doctor when it is safe to be around other people again. Okay, so now let's go to another disease, that's bilharzia. So under this disease, we will learn about causes and mode of transmission of bilharzia, the symptoms of bilharzia, and probably prevention and control of bilharzia. So these are the things that we are coming to discuss about what? Bilharzia disease. So you pay critical attention to this. So have you ever seen blood in your urine before? Or do you normally see blood in your urine? It may be a sign that you are suffering from the disease called bilharzia, that is schistosomiasis. Schistosomiasis is spelled S-C-H-I-O-H-I, I'm spelling it again, S-C-H-I-S-T-O-S-O-M-I-A-S-I-S. It is important that you report to the hospital or the health center immediately for medical attention. So how is bilharzia contracted or transmitted? Let us study the let us study how it is transmitted or what, or it is contracted. So causes. Number 1, causes and mode of transmission of bilharzia. Bilharzia is caused by the parasite called schistosoma. Schistosoma is spelled S-C-H-I-S-T-O-S-O-M-A. Schistosoma. That's a blood fluke. The parasite can penetrate into the skin of anyone who is bathing, swimming, or just wading through contaminated water. Within weeks, they penetrate into your blood vessels and produce eggs. Some of the eggs can pass into your bladder and then pass into your urine. When someone suffering from bilharzia urinates or defecates into any fresh water, the water becomes contaminated. That's why it's not always advisable to be bathing in pools and other water bodies. So let's go to symptoms of bilharzia. 1 is blood in urine. 2, anemia. 3, itchy skin. 4, pain in the muscles. 5, poor appetite. 6, loss of energy. So if you have bilharzia, so these are the symptoms that you will be showing. So let's go to the last one, not the least, prevention and control of bilharzia. 1, if you drink from streams, make sure you boil the water before drinking. So by boiling, the water snails which can hide the parasite are killed. So you have to boil your water before you drink it, or you use it for otherwise. 2, avoid bathing, wading, washing or swimming in contaminated streams or ponds. 3, avoid urinating or defecating in water bodies. 4, prevent people from urinating or defecating in water bodies. Okay, since we have known the causes, the mode of transmission of bilharzia, symptoms, and prevention, let's go to another disease which is called typhoid fever. So under typhoid fever, we will learn causes and mode of transmission of typhoid fever, symptoms of typhoid fever, and prevention and control. Prevention and control, not prevention and control of typhoid fever. So have you ever been diagnosed as suffering from typhoid fever? What are the symptoms of this disease? So sometimes when people have typhoid fever, they think it is malaria. How different is typhoid fever from malaria? So now we will learn more about malaria in our next video. So let us study the table, the causes and the mode of transmission of typhoid fever. So typhoid fever is caused by the bacteria called Salmonella typhi. Salmonella typhi is spelled Salmonella. Typhi, Typhi. So when you eat food or drink water contaminated with the bacteria, you get infected, or you be infected. As it enters your body, it passes into your intestines. So from there, it enters into your bloodstream and then to other parts of your body. So let's look at some symptoms. Number 2, the symptoms of typhoid fever. 1 is diarrhea. 2 is feverishness. 3, general body weakness. 4, abdominal pains. 5, blood in stool, that is feces. So these are the symptoms of typhoid fever. So let's go to prevention and control of typhoid fever. 1, eating at places with good hygiene. Do not be eating roughly, by heart. Anywhere you see them selling food, you go there and buy it. So make sure where you are eating, that place is, the condition there is very nice, hygienic condition. 2, eating of food that is warm. 3, drinking clean treated water. 4, covering food and water to prevent contamination. When you cook and you are not about to eat the food at the time that you have prepared it, just cover it, and then to prevent contamination. And last one, use of antibiotic drug to treat the disease. So you must use antibiotic drug to treat the disease if you have. If you do not have, do not attempt to use antibiotic drug until you have been described by your doctor. Another disease that we talk about is poliomyelitis. So we learn about causes of mode of transmission, causes and mode of transmission of polio, symptoms of polio, prevention and control of polio. So poliomyelitis, often called polio, is a highly infectious disease and it usually affects young children. So this disease has no cure. It can only be prevented by immunization. So you can see that the government, through the Ministry of Health, has a program where young children are immunized to prevent them from contracting the disease. It is important to inform your parents to send your younger siblings for immunization anytime you see or hear the adverts on television or radio. So sometimes the adverts are done using community vans that travel through the community. So let's go to the causes and mode of transmission of polio. Polio is transmitted by a virus. It is transmitted when infected feces enter the mouth of a child. It can also be transmitted by eating contaminated food and drinking contaminated water. When the virus gets into the system, it multiplies in the intestines and later invades the nervous system. This can cause paralysis. So let's go to symptoms of polio. 1. Feeling of stiffness in the neck and pain in the limbs. 2. Paralysis of the legs. 3. Feeling feverish. 4. Headache. 5. Vomiting. 6. Constant feeling of tiredness, that is fatigue. So let's go to the prevention and control of polio. As we said earlier on, there is no treatment or cure for polio, but the only prevention or control of polio is vaccination or immunization. You must be immunized or vaccinated. Okay, so now let's go to another disease which is called guinea worm. So we will learn about causes and mode of transmission of guinea worm, symptoms of guinea worm, and prevention of guinea worm and control of guinea worm. Okay. So have you ever seen a patient suffering from a guinea worm infestation? This disease is prevalent in areas where there is lack of clean drinking water. So can you mention some areas in Ghana where guinea worm infestation is common? So you realize that in these areas, there is usually a lack of clean, potable water. You might have seen some of these areas on television, especially during the news segments. So over the years, the government of Ghana has worked tirelessly to ensure that this disease is completely eradicated or removed in the country. So what are the causes and mode of transmission of guinea worm disease? How can it be prevented? So let's go to the causes. It is caused by a nematode called Dracunculus medinensis. Dracunculus medinensis. So let me spell them. DRACUNCULUS medinensis. That's Dracunculus medinensis. When an infected person gets into contact with the water by wading or swimming or bathing, the water becomes contaminated with the parasite. As soon as you drink this water, the parasite is released into your body and develops into guinea worm just under your skin. It forms a blister which later bursts to form a sore. Let's go to the symptoms of guinea worm. 1 is painful blisters on the skin at the area where the worm is. And 2, blisters develop into an open sore. 4, vomiting. That's 3, vomiting. And 4, fever. So these are the symptoms of guinea worm. So let's go to prevention and control of guinea worm. One is drinking clean, purified tap water or borehole water. 2. Boil water before drinking. This kills any parasitic flea that may be present. 3. Ensuring that persons suffering from guinea worm infestation are prevented from coming into contact with source of drinking water. The last one, filtering water before drinking. So this brings us to the close of the video.